My name is Dr. Barratt Phillips, and I'm one of the partners here at Inland Eye Specialists. I am a cataract and LASIK specialist. There are actually several reasons I would recommend choosing Inland Eye Specialists for your LASIK surgery. Most importantly, and number one, is experience. I've been doing laser surgery since the late 90s, and technology has evolved a lot over the years, and my partner and I, Dr. Johnson, are very experienced in all types of refractive surgery. The other advantage of doing it here is that we provide a lot of options for patients. Some places are LASIK only, and we offer a variety of refractive surgery options, or in other words, surgeries to correct your vision. LASIK is our preferred procedure, and for most people it works great. But if you're not a perfect candidate, there are also other ways that you can have your vision corrected. And the nice thing as well at Inland Eye Specialists, because we've been here for so long, is the service. We do not have doctors that come in from out of town, from out of state. We are the same doctors that have been here year after year doing the same excellent surgeries and working with your doctors here in town, and we will be the same doctors in years to come. LASIK consultation is very important, and anyone who's looking at laser surgery as for their vision correction, most importantly, needs to have a healthy eye. And so as part of your LASIK consultation, you'll come in and have a full eye exam. And then there are a series of special computers that analyze the surface of your eye, the shape of your eye, and other parameters that let us know if you're a good LASIK candidate. The whole consultation is free, and after the consultation is performed, you will work with our surgery schedulers and the staff to help see your journey the rest of the way through. But the LASIK consultation is with the physician face-to-face to make sure that everything is perfect for you moving forward. Well, I've had LASIK myself. There are many benefits of LASIK. Actually, both Dr. Johnson and I have had the procedure performed. And so personally, I can say for a lot of the activities that I do are outdoors, rock climbing, surfing, mountain biking. It's just amazing to be able to be out there doing these activities without the hassle of contacts or glasses. And being in my 50s, the other advantage is that you can also correct so that you have some of that near vision left over. And for those patients in their mid-40s and older, that's a great benefit to have both the distance vision and the near vision that can be preserved in most cases so that you can enjoy all your activities. And so as far as, candidacy for LASIK, it's, someone who's looking for this freedom from glasses and contacts, someone who has a healthy eye, and I think that, a lot of people don't know that they're good candidates. The biggest hesitation is going for the consultation and finding out. I have lots of people say, well, I was told a long time ago that I wasn't a candidate. And with the technology nowadays, most people are a candidate for LASIK or for some way to correct their vision. And as the consultation is free, I highly recommend investigating and finding out if you're a candidate. LASIK can correct a variety of prescriptions, if you will. Most people have heard of being nearsighted or farsighted. The technical term for that is myopia or hyperopia. A lot of people also have something called astigmatism. Astigmatism has to do with the shape of your eye. Very few people have a perfectly round eye. Usually it's steeper on one side than the other, and this creates a blur in essence. And so the LASIK procedure can correct both nearsightedness and farsightedness and astigmatism at the same time. And so when you come in for a LASIK consultation, all of these parameters are measured. Typically in a pair of glasses, people will notice that they have 3 numbers, and that represents the correction, the nearsightedness or the farsightedness, and that astigmatism. When the computers, as part of your LASIK consultation, measure your eye, they look at hundreds of numbers, far beyond what you could check with an optometrist in a regular exam. And so we take your base prescription and the computer analysis, and by the time that you're done, we will know if you're a candidate for the procedure. And for those people who are, it's a custom treatment. Nobody's prescription is exactly the same. The computer basically analyzes your eye like a topographical map. All the hills and the valleys and every nuance of your cornea is carefully mapped and integrated into the computer and for your treatment so that you have truly a custom experience. And what that does is some people even go beyond 20/20 and with what they're able to get out of their correction. It's a very good question. There are several diseases of the eye which are not appropriate for LASIK. One of the common ones we hear about is someone who has what's called a lazy eye or amblyopia. And that's a condition usually from a child, age of a child, where the eye did not develop fully. Sometimes it's due to some eye disease. Usually it's due to a very high prescription in one eye versus the other. And the eye with the higher prescription just does not develop the neurological pathways that allow it to see properly. And so no amount of correction, whether it be glasses or contacts, will help that eye. And LASIK, in the same line of thinking, is not able to correct that type of vision because it's neurologic. There are other things that are not recommended for LASIK. If someone's older and is developing cataracts, that's a problem inside the eye where the lens is starting to become cloudy. Again, if we do a fantastic correction on the surface of the eye, it's not going to fix any problem on the inside. And that's where that healthy eye exam comes into play. We want to make sure that the eye is perfect. Most situations, patients come to me who have had LASIK done somewhere and they're having difficulty with their results. It is usually because they were not a great candidate or there was something else going on with the eye. Even if the surgery was done perfect, something else going on that's preventing them from really enjoying their vision the way they expected. Well, I've had it myself, and so I can definitely answer that question. LASIK does not hurt, and that's probably one of the most common questions that we get. Is LASIK scary? For some people it is. That's natural, but it doesn't have to be. And I think a lot of that comes from understanding what's really happening. Patients in their consultations sometimes are worried or anxious, and it's mostly about the unknown. Once I get a chance to visit with them and tell them about the procedure and what to expect, there's really nothing to be afraid of. When someone comes in for their laser surgery, the eyes are given numbing medicine that completely deadens the eye to the point that they will not feel any of the procedure. The nice thing is, in our facility, we use an all-laser LASIK, and so there is no cutting or shots or stitches or anything that would inflict any pain to begin with. But nevertheless, we give lots of numbing medicine regardless, and people love that. During the procedure, basically the laser comes in and the procedure uses light in order to reshape the cornea, and there is some pressure that is felt. And I talk the patient through the procedure so they know what's going on, and it takes less than 10 minutes. And when people are finished, they usually say, wow, that was a lot better than I thought it was going to be. And so generally the LASIK is a very comfortable experience. Afterwards, when the eye is healing the first 24 hours, there is some scratchiness, and patients are encouraged to go home and rest. And that's very normal for the procedure, but definitely not anything to be afraid of. LASIK is a very short procedure. Usually, if someone's having both eyes done, it takes less than 10 minutes. The real commitment for LASIK comes in the preparation. We want to make sure our patients are very prepared and have a thorough exam, and that's where you want to invest your time. And that's part of the consultation that you'll have with our physicians, making sure that your eye is completely ready to go for the surgery. When the surgery day comes along, again, it's a very short process, but the entire time, the nurses that are working with me and myself, we're guiding you through the procedure so that you're comfortable and understand what's happening. And if it's necessary, sometimes we'll give you a little oral medication to help you relax, and that can be beneficial if someone's interested in that. But the whole process is very short and very comfortable. LASIK lasts a very long time. Typically after surgery, the first couple days your vision's recovering and it's a little blurry. People can often go back to work and activities such as driving the day afterwards, but each person heals a little bit differently. But generally, LASIK heals very quickly, and once it stabilizes, it will last a lifetime. The only thing that prevents LASIK from correcting your vision forever is that sometimes when people are older, they will get some other diseases or conditions such as cataracts or retina problems. And there's no way to predict what will happen, but patients who have surgery in their 20s can anticipate having that kind of vision correction for their lifetime. Now, the only thing that may change is that everybody, regardless of whether or not they've had LASIK, once they get into their 40s, generally will start having some issues with reading vision. And this is because the muscles inside the eye tend to weaken with time. And you may have seen your dad or your uncle holding that book out in front of them trying to see the small print. And that happens to everybody. If someone has distance correction done in their 20s or 30s, eventually when they get to their 40s or 50s may require some glasses for reading. Having said that, those who come in for LASIK surgery already in their 40s and 50s, we typically will do a correction called monovision, and that's where one eye is corrected strongly for distance, and the second eye is corrected, leaving a little bit of nearsightedness so that they are able to pick up and do items on their phone or computer or look at things up close, and makes things very, very much functional for them, both distance and near.